morning, friends and colleagues, and good evening or good afternoon. Thank you for joining our Global Cafe today. It is really a pleasure to be speaking with Mr. Dan Levitt today, talking about reforming the world of long-term care. And fortunately, Dan's still a young man, so that he's got lots of time to be able to reform the world of long-term care. So I'm interested to hear your perspectives, Dan. A little bit about Dan. He's an acclaimed international speaker on elder care and elder care leader, writer and gerontologist, specialising in helping others to create better lives for seniors. Dan's purpose is to teach people how to transform the lives of older adults across the globe. As a popular professional speaker, he has delivered inspiring keynote speeches impacting thousands of people in 4 continents. Dan does tell people where to go, but guides them. Doesn't tell people where to go, but guides them in the direction of where they need to go. His talks leave the audience with new mindsets on aging and how to thrive in the 21st century. He's also the Chief Executive Officer of Kin Village. And Dan, I'm sure you're going to talk a little bit about your vision for Kin Village as we move through the cafe today. He's inspiring a team of over 400 employees and volunteers with a commitment to continuously improving the quality of life of older people. An adjunct professor at Simon Fraser University, School of Nursing, University of British Columbia, and a sessional instructor at British Columbia Institute of Technology. Dan, you are also on a number of boards. You're also a director on the IFA Board of Directors. I know you're also involved with Common Age. So tell us a little bit about how and why you got into the field of aging.
Thank you, Greg, for the introduction. Sorry about my brief departure, and I'm glad I'm back in. So how did I get into this? I remember going to visit my great-grandfather who was living in a care home where I witnessed the conditions he was living in. And they weren't conditions I would expect. And I was saddened to see what it was like. He lived in a 4-person ward with other people separated by curtains. I remember walking down the hallways and seeing a resident restrained in some kind of a long kind of like tether to a pole and almost like an elastic band. When the resident would walk a certain point, he would be pulled back. And I remember the director of care approached me and kind of explained or defended why the person was restrained. And it was heart-wrenching to watch my grandmother care for her dad. And a little bit of further context is this was the nursing home that my dad was the CEO of.
Wow.
So I thought, we talked a lot about my dad and I over the years, and I knew we could do better. I knew there was a better way of doing it. And I thought they eventually reformed that home, changed it considerably with a cultural change movement. And then I really wanted to follow up my dad's footsteps and join a movement of a lot of us are a part of, and to see that there's a better way of caring for older people who require assistance as they age.
That's quite remarkable. To see people's restrained, still the 4-bed wards, which I hope never exist ever again, but I know in some places they do. Can you tell us a little bit about Kin Village and what the vision is for Kin Village? Because I know you're going through some redevelopments and some new housing options. So can you tell the audience a little bit about what Kin Village is and where it is?
Sure. So Kin Village is located in Tsawwassen, which those of you who have been from Vancouver going to Victoria, you drive past it on the way to the ferry. It's where the ferry terminal is located. But Kin Village it's sort of a peninsula of Greater Vancouver, and it's a lovely community where we have, I call it kind of the full spectrum of the continuum of care on one campus. It's quite unique for British Columbia and for Canada, and even for kind of the rest of the world. We have the hub really of the heart of Kin Village is a community center, which is a vibrant place where seniors of all ages. One of the seniors just celebrated her 99th birthday. We had a big party for her. There's a cafe with gourmet food, a clothing store in that community center that sells pre-worn clothing for women, so women can feel good about themselves. And the people who work there are women who helps with their self-esteem and just gives them a purpose. The community center is vibrant. It's really the center. On the other side of the community center, there is a long-term care home. 100 people live there. There is a 20-person specialized unit for people who have kind of advanced dementia with expressed behaviors. We have assisted living there, and we have affordable housing for seniors on this campus. That's really the stuff that happens on site. About 300 people live there, and we also serve the community. So we have a Meals on Wheels program, which doesn't only address nutritional issues and food security issues, but also addresses these volunteers will go in and they'll kind of inspect what's going on in that senior's life in their own home. And we have a day program for older adults, which is part of our redevelopment, and we're serving a dozen people a day, and we have capacity in our new building to more than double that. Day program is probably one of those aspects of long-term care that I believe is kind of undervalued, especially if we're pushing that pressure on to the community. And another program we have, which I think is innovative in the past few years through the United Way and through government funding, is called social prescribing, which many of you may be aware of. We call it the social navigator. So instead of the doctor giving you a prescription for medicine, they give you a prescription for social services. And we have a navigator that helps the person connect with the healthcare system or social service system. And then, Greg, to answer your question exactly, our redevelopment plans are to replace our outdated buildings. I use the outdated word instead of aged on purpose. We like aged. Outdated is not good. Our long-term care home is an institution in terms of the way it's designed. We try to operate as a home, but it's very challenging to do that with the current infrastructure. So we need to replace that home. But our first phase is affordable housing for seniors. It's a government-funded program, 152 units of affordable housing, and we'll be demolishing one of our buildings after that is currently housing those people, and then we're expanding that building, and then eventually we'll put the adult day center in the main floor of that, expand that, and then we'll look for our next project for that site. But it'll probably be either housing or long-term care if the funding's there for it. And eventually we'll more than double the capacity of our campus. And we're right in the heart of Tawasin. That's why I think this is an ideal organization. We're walking distance or scooter distance. We have a resident who lives in our care home who himself propels himself to the town center. There's stores and stuff to do there, banks and cafes, and we're right in the heart. There's a large field where soccer is played and lots of commotions going on in that area. So it's the place to have a home. It's not next to the hospital, isolated from the community. So it's really an ideal place.
Thanks for that, Dan. I would certainly encourage people to put questions for Dan in the chat function, and I will call on people to pose those questions to Dan as we go throughout the session. You talked about daycare programs, and it really has fascinated me. I was part of the development of daycare, long-term care daycare programs in the Australian system 30 years ago, and it always, I suppose, shocked me to an extent where they didn't have the extent of daycare programs here in Canada when we arrived. And even today, I don't think there's enough emphasis on the benefits that daycare programs for seniors provide in the community. So having infrastructure in your home where you can actually bring people from the community into a daycare program to give, whether it's regular programs, whether it's offering a bit of respite for an individual who might be caring for that individual, is a really valuable service. And I just hope that others, provinces, other homes pick up the mantle and say, we want to develop daycare programs. But the issue, I think, is, does government recognise the funding support for daycare programs? So your daycare programs, how will they be funded? And is there specific target audiences?
Yeah, so Greg, you raise a really good point, and if you kind of have that lens of kind of I'll just throw it out there, ageism. When we look at how we fund the geriatric system or the long-term care system compared to acute care or other things in maybe education system, it's really questions really priorities. That care home I was mentioning where my great grandfather lived, and both my grandmas ended up living and my dad worked at. It's a kilometer away from where we live in Vancouver, but it has to be rebuilt. It's even more outdated than the care home where I work. And there's a school just down the hill from there where my wife went to high school, and it's being seismically upgraded. Huge investment, and but the care home still sits the way it is. So to your question, we're struggling right now. Certainly, I'm struggling with the way that we're funded and prioritized by Fraser Health, by our government. So we have a contract to operate the adult day program. So many spaces per day. How much we get reimbursed per day for the clients? How much the clients pay? The clients pay, I think, $10 a day. The most of it is funded by government. It's a really great program, a great funding model. It is prioritized in terms of that aspect, but our contract has been year to year. So we have a 12-month contract. This is kind of the piece I don't quite understand. I can't imagine taking that to the bank and getting a mortgage against the value of that space, or getting a lease agreement with that. So we've asked for an indefinite term contract like we have for long-term care, and they've gone to 3 years. It's an important program. And Greg, you're right. It is something that's underutilized in some long-term care systems. And I think if we're not going to build the number of care beds we need to really support that, and home care and other community-based services, because I think caregivers are under incredible amount of stress, and we need those kinds of systems in place to support people so they can live independently.
Dan, you mentioned home care, and I'm curious in terms of from the infrastructure that you have, do you also deliver home care? I mean, I know you deliver Meals on Wheels, but do you do other personal care services to individuals out in the community which are also funded by government?
So we don't do that, but which kind of then for me leads to kind of that sort of disjointed, siloed approach to long-term care. We really are in a geographic area of Vancouver where it's really isolated. You have to essentially drive on a country road, several kilometers, or even on a highway to get to the next community, which is Ladner. And they're very separated. So if I had my druthers my way, we would essentially have the responsibility for all the older people and people who need our services. There are people with disabilities or other conditions that might need our services under 65. So we should have, from my point of view, the responsibility of serving all those people in that geographic area. In the United States, they call it the PACE program, where you have kind of like it's a capitated model, and you have all that responsibility. So you're responsible for people who are going to become nursing home eligible. So the home support services in our area are operated by the government, by the health authority, and it is an important service. But I think the piece that's missing is that care coordination, which is really a core function of the BC long-term care system. When you think about BC long-term care system, one of the prefaces of it is that's a strong case management function. And I think that's where you get those silos, because we're not connected. So it is separate, and it does lead to things like when you eventually need long-term care or assisted living, you could be, I call it displaced. We're the only nonprofit and only funded operator in our community. And if you needed care, and your first choice was Kin Village, you could be sent to another care home, a 10-minute, 15-minute, 20-minute, or even further, half an hour drive away. And for spouses who can't drive, it's very difficult to see your spouse. So that's why I think Kin Village is quite unique. Is one spouse could live in assisted living, the other long-term care, independent living, or even if they're not living on our campus, they can live in home. And I think home care and that whole community-based service, keeping people independent in their home, meeting their health needs and social needs, is critically important. And I think it should be all integrated into one healthcare system. So from the user, from the person in the system, it looks seamless.
Yeah.
And appreciate there's no cloth or no thing we can wear that is seamless. So it's got to be well tailored to the individual.
Yeah. Okay, thank you for that. So as people are populating questions, I might ask a couple of those questions to you, Dan. I'll call on people, but one of our regular contributors, which is Small from Israel, according to you, the need for ensuring equity in accessibility for poor and low socioeconomic groups in long-term care. So is it a challenge here in Canada? Is it a challenge for you? Is it a challenge globally that you see in terms of how do you actually ensure some equity, particularly for those low and social economic disadvantaged groups?
Well, it's a good question. We are if you will, the social service agency for seniors in Tawasin, that are part of Vancouver. And there is a high-end WEX for-profit community called Wexford. When you drive into town, it's one of the first buildings you see. It's beautiful. It's lavish and everything. It looks like a five-star hotel. It's very hospitality movement. So if people have cash available, funds available, they can certainly live there. It does happen sometimes those people run out of money, or they eventually need further care and they move into us. But we welcome anybody. A lot of people in social housing, in our affordable housing, they really are the people that have-nots. They're people who have, for whatever reason, not accumulated wealth. They don't have much income. The government supports them. So we really have 300 people who live on site and people in the community. I would imagine the majority of them are kind of on the lower end, if you will, of resources, and that's the way it should be. We should be caring for those people. We don't discriminate on someone's wealth or their income. As long as they meet the criteria of needing the service, they move in, and the government assesses them on a sliding scale based on their income. Assets aren't touched, which is another conversation we can have, but they look at income. So you could have a lot of income, you pay the highest rate. If you have a low amount of income, or in some cases no income, you're totally government supported, which I think is the right way of doing it. And I do think our model that way is great. One of the interesting things about our model is that when you start talking about the total cost of it, it's kind of hard to imagine this, but it costs at, I'm going to say $6,500 a month for a long-term care home to operate, but $250 a day in Canadian dollars. There's a brand new a dementia village called the Village in Langley, which is state-of-the-art, probably the way we should be building a lot of these places. And they're charging $8,000 to $10,000 a month. Well, so it's marginally more money than what we're charging the government essentially. But when you think about the value there, if you had the money and you could go there, great. But we should be, I think, funded and supported by government that amount to create those kinds of environments and pay the capital cost to create a much better, robust place for seniors to live.
Yeah, it's certainly a challenge for families to be meeting, $8,000 or $10,000 a month costs for care. And I know, it may have changed somewhat in the Australian system, but I know in terms of needs in the planning model for long-term care, you would know exactly what the demographics of a region was, and you'd know what the financial resources that people had based on percentages. So for argument's sake, if in your region 25% of elderly people were considered financially disadvantaged, or in other words, all they received was the maximum rate aged pension, your home would have to provide 25% of its beds, whether you were private for profit or not for profit, to financially disadvantaged individuals. And you could only charge them the percentage at that time, I think it was 85% of the maximum rate aged care pension, that an individual got. So there was some equity across whether it was private for profit or not for profit based on the demographics of the region. So no one really missed out. But certainly there was a huge difference in what some individuals paid as opposed to others paid and what the governments contributed. So that's certainly something that I don't think exists very well here in Canada. So quick question. What are the 5 challenges facing long-term care that you see, whether it's Canada or whether it's globally?
Well, thanks, Greg. So 5, okay. Well, I'd say the first is informal caregivers. The burden, if you will, on our family members as they go through that journey. It's very heavy. Our next door neighbor, Ken, his wife Maureen, had vascular dementia. And as he cared for her at home, I would talk to him and hear what her journey was. Is very heavy. And when I asked him, kind of why he was doing this, because she was eligible at that point for long-term care, he said, well, I made a vow to her when we got married. And she went to adult day programs and then eventually moved into a care home right at the beginning of the pandemic. And I just know, and he's a dedicated husband, goes there sometimes twice a day. And I just think the kind of supports that we need for informal caregivers is huge. So that's number 1. Number 2, I think we're talking about it, but the limited resources that long-term care has, that we're not funded, supported by society in the same way that other parts of social services or healthcare is. I think we still are kind of the poor cousins to acute care. And because I think of our perspective of youth, we value, I think, the education system. And certainly my daughters are benefiting from it, the public education system. We certainly value that, I think, a lot more than we do long-term care. So making sure we can improve resources long-term care. The third, I would think, is the workforce, is investing in our workforce more heavily so that we have the right people doing in the right places. As one example, probably a lot of you have already heard the lack of geriatricians as an example. In Canada, for every 1 geriatrician, there's more than 10 pediatricians. And appreciate they have different functions in the healthcare system, but it shows you our priorities and where our mindset is. And also, I guess, the disincentive of working for the older population versus the younger population. So we need to make sure we have not just doctors who are specializing in geriatrics, but also nurses and care aides and other allied professionals. And we still need our support services workers. So we really should be valuing them, I think, paying them. An ICU nurse in British Columbia gets paid more than a head nurse working in a long-term care home. And I think we've got to reconcile that. In some jurisdictions, all nurses are paid the same amount regardless of where they work. And another aspect is, I think, digitalization of long-term care, putting more IT investments into our system. And it could be in the care home. Right now, we're considering technology for every resident room where we can know their biometric indicators, their heart rate. We can know their blood pressure just by a device that we would install either under the bed or in the ceiling. It would also detect their falls and help prevent severe injury, which often leads to bad outcomes. And the other thing it would do is monitor sleep so that we can see if the person's had a good night's sleep. Then we can adjust their medication if they were requiring some. And the last one is really around, I think, how do we come out of COVID-19? We saw the devastation that the pandemic had on long-term care, and I think as the number 5 point would be, how do we really look back on that, not forget what happened, and use that to propel ourselves forward and have kind of that transformational aspect happen to long-term care that we all envision. And we certainly all have a personal vested interest because, as we all know, once you're 85, you have a 1 in 3 chance of requiring care either at home or living there. The other third of the people will be caring for that person. And the last third of the people population will never see probably a long-term care home. But for those people who are the caregiver or the person requiring care, I think we owe it to ourselves to change the narrative and not repeat what happened. And we haven't yet, I think, gone far enough to ensure that never happens again.
Yeah, I certainly know here in Canada there was lots of talk post the pandemic of what the governments were going to do to reform and support older people and make the necessary changes and build more beds, not necessarily home care, but just talking about beds rather than anything else. But we're yet to see some of those things even start, not even a shovel in the ground in many cases. So it's certainly going to be a challenge in every country. And I know that every country would have been probably saying the same things the Canadian government did. So it'll be a wait and see exercise for all of us, I think. Catherine Klein, can I call on you? You've posed a question for Dan. Can you open your mic and ask Dan your question, please?
Sure, and thanks, Dan, for all of this information. My 97-year-old, very healthy mother lives in an excellent, funded by multiple sources, residence, long-term residence with progressive care on different floors. And I visited her last year and very much admire the staff. So it's not the staff, but I'm very curious why she often is the only one to go to any exercise class, the only one to almost do anything except if they have food or drinks available. And there is a social worker on site. So I've been sort of encouraging her to ask the social worker, what does she do? Are these people sleeping? Are they ill health? How do you get people to come out? And they try all kinds, they do picnics, they go to art museums. I mean, it's really an excellent facility. And the one thing I wanted to add, because it came up in what you were talking about after I put in my question, is that it's faith-based, but it doesn't matter what faith you have or none. And I have had the woman who raises the money come and talk about how they do it, because if you run out of money and it's private, they keep you. There is no exiling you to some other public facility that may not be as good just because you lost funding. And then my final question is, you talked about not including assets. What prevents, and maybe it's just Canadian honesty, but what prevents people from having tremendous assets but a very low income and therefore getting government support when quite frankly they may not need it? Thanks.
Okay, so I think maybe I'll go backwards, and if I forget one question, you'll cue me. The asset question is an interesting one. I think the mindset in Canada is that when we pass on, when we die, we leave our assets to our children, primarily, and to charity, but mainly to our children if we have them. And I think there is kind of that generational conflict would certainly arise if that tradition was intervened by people who, for whatever reason, required care and had to spend down their assets as a result. Now, that being said, I personally am a proponent of spending your assets if you need care, if you chose to, and if there's a way of doing it. So in my own case, my parents could afford to put a mortgage on their house if one required, and whenever they sell their house at some point, and if one parent passed away before the other, eventually they pass away, the one who was living in the house, so their house would certainly just be worth less to their heirs, which I think certainly we would be fine with. But the Australian model, kind of that Greg was talking about, which I visited a number of times and studied and wrote about, I found very intriguing, the bond model, which is that when you move into care in Australia, and I know some of you from Australia can probably explain some of the nuances of this, but the general concept, the way what I took from it is that if you have the resources, you would essentially buy a bond, which I would call kind of a condo, an initiation fee that is held, like in Canada, we call them life leases for housing, but they're not connected to care in Canada, unfortunately. What I'd love to see is whatever that condo value is of that space, that your heirs would get it back at the end. They either get back amortized value, lesser than the amount. Sometimes they get interest and get a larger amount. And depending on where you're located, if you're in central Sydney, you might be paying a large bond. If you're maybe in a more rural area, you pay a smaller one. But the great thing about this is that the bond is calculated depending on, I guess, the value of your wealth. And if you can afford the higher one, then you're paying for essentially somebody else who can't afford one. So I love this idea because it's it hits that ideology that everyone should be able to move in and everyone should be able to get the same quality. It's not just a first class service. Everyone gets that same service and no one knows who's paid the high amount, who pays the low amount. So I believe a bond model would get it done. And why do we need this? It's because the lack of investment in long-term care beds, that we haven't seen the kind of investment outside of Ontario in Canada, which is building 60,000 new and replacement care homes for a population of about 15 million. In BC, we have 5 million people. We're building less than 5%. We're building, sorry, less than 10%. We're building under 5,000 new and replacement care homes right now. And we should be building 20,000 based on our population, according to the Canadian Institute of Health Information. How many beds do you need per thousand? So that was your first question. Sorry, your third question. The second question was around mom being, I think, feeling isolated in her room. Sorry, not feeling isolated in her room, that her friends feeling isolated in their rooms. So I'm going to chalk it up, if I could. I need to learn more about her situation, but your mom may be more outgoing and has a choice in her care plan, in her social plan, to be involved in activities. Those of us who want to be part of the party would love that. Some of us are maybe more introverted, want to spend time alone in our rooms, should have the choice to do that. But as long as they have the choice, and that's their pattern before they moved in, no one should make decisions for them, which we sometimes see. But I would chalk it up to this, the actual physical environment. The classic nursing home, the traditional nursing home, is one with long corridors where the person who lives in that room is dependent on the care aides to get them out of bed and dressed and groomed and bring them into the dining room where they wait for breakfast. And then they're ported back to their room and maybe they're ported to activities. And it's that very institutional controlled model where it's regimented. The TEDx that Luana posted in the chat box, I talk about that experience for grandma at the same care home where my great grandfather lived. But I think that's what I think happened. So to get people out of their rooms, it's a challenge in that environment. And the third one, I've forgotten the one you asked.
Yeah, I'm trying to remember what the third one was. That's what I was muttering. Don't worry, go on, it's fine. No, the only thing, Dan, to add is that it's an excellent place, and this is for independent living. So these are presumably not people, although what she's seeing since she's been there for 7 years, that people are waiting longer and moving in far more frail, and that the kind of activities with dances and all kinds of things that she heard about, which is partly why she picked that place, no longer are what people need or want. So I think it's the population as well that's changing.
Yeah, and Catherine, that's an interesting point. I've never really understood kind of who made that policy decision, where people are moving in later to long-term care, and especially later because I guess you could ask the question, have we trained people who are caring for these people working in long-term care? Have we trained them enough for the current population we have? A lot of us were educated decades ago, and we were educated for a population that we don't really see for the most part in long-term care. We're seeing people who are older, frailer, sicker, require more assistance, more needs. We used to see people who were mobile. I think when Kin Village opened, people were driving. It just shows you that, the difference. Now they have a tough time transferring from bed to wheelchair and getting to the bathroom. And why are we admitting people later? And the only way I can rationalize this is, the only answer I have is that we have not built enough long-term care beds. We haven't prioritized it. For the number of beds per 1,000 people over 65, it's decreasing, not increasing, at a time when there's more need. So I think that's my explanation why people are more advanced when they moved in. And I don't know if that's something we've all agreed to as a society. And I believe you should be able to move into long-term care when you think you need it, when your family and yourself have determined that you no longer can live independently. It shouldn't be something that you have to wait for, to be eligible for, and to move in for.
Thanks for that, Dan, and thanks, Catherine, for your questions. And certainly, there's no doubt that people are waiting a lot longer to go into long-term care, and even retirement villages. I mean, people are waiting longer to go into retirement care, so they are coming in with greater degrees of frailty. So it's certainly going to be a challenge, but still it's not enough emphasis on the support for people in their own home, and how do you actually support individuals for longer durations in their home. And I think to an extent, home care programs have actually, while they've supported people in their own home, which is a great thing and should happen more of. I mean, clearly when they do go into care or a retirement village, their level of frailty is certainly much more significant than perhaps it was when Dan was talking about the number of people that would drive that. And I can remember going to long-term care homes 30 years ago, and the car parks were full, and it wasn't a car park full of cars from staff. It was the residents of the home which were out and about and driving their cars. So things have changed, and certainly change will continue to occur. Cara Littlemore, can I call on you to pose your question to Dan, please?
Hello. My question was, what small steps can we take as individuals to get the attention of government to show that we want sustainable change to be made?
Great question. And Kara, if you have any thoughts, or others do, I'd certainly love to hear from you. I think telling positive stories about long-term care, or just about older adults. I think there's a number of things. I think so. One example we're doing is we borrowed the idea from another organization, but we're doing a gala dinner, our first, I think, in a long time at Kin Village, and we're calling it 7 over 70. So we are going to recognize 7 people over 70 years of age who, in I guess their elderhood years, have done something new, contributed tremendously to their community in various capacities. We're going to recognize a diversity of group of people, and we want to showcase people over 70 make contributions, so that the image that you see on a birthday card in the humor section of the card store, that none of those things are really the narrative we want to be telling. By the way, those cards should be outlawed from my point of view. So what can we do? So I think we can be telling positive stories with seniors generally. Also, sure, the seniors who are, still running marathons, doing all those things, jumping on airplanes, all that stuff is great. But I think also telling the stories of these organizations that are really doing great things and that are innovative, that are caring for seniors and making a difference in their lives. And I think, to the main point really here is taking documents that the IFA is producing. I'm associated also with Global Aging Network. They just produced a document called Call to Governments. I think it might have been circulated to this group as well. I can certainly get you a copy. I was one of the co-authors of it, and we looked at all these issues, and it's a document that helps governments, I think, step up and meet kind of, if you will, those standards that we want to see across countries. So talking to your government officials obviously is always important to do. Your local person that you voted for, to make sure they know how important this is, and perhaps even encouraging bills and legislation that would make those changes. And I guess, yourself getting involved in organizations that are doing a great job serving, and perhaps getting on a board of directors or influencing change that way. I do think it's going to take a lot of us to step up and show the world that older people matter. And regardless of your perspective on this, I think putting a 106-year-old on the cover of a Vogue magazine is a good step in terms of addressing ageism. I think well done, Philippines. She's beautiful. I think aging is beautiful. Ageism is ugly. The woman on the cover, I got a copy given to me by some members of our community who have access to that magazine. I'm going to frame it, put on the wall. I'm not sure if we're going to frame the other magazine. I'm going to ask my wife about this, but seeing Martha Stewart on the cover of Sports Illustrated, sure, you could critique, the advantages she has, and maybe some self-admittedly some things she does to look a certain way. But what a change that is of showing off an 81-year-old being attractive. I mean, what does that do for the rest of us? It's so important. So what can you do? I think really push against the tide, if you will, push against the river and the misconceptions, and be out there advocating.
Thank you.
Thanks, Karen. Thanks, Dan, for those comments. And certainly, Brendan, I know your comment was vote, use your vote. And that's what people need to do. And I know whenever there's elections happening in Canada and people knock on my door, I always have a series of questions that I want to ask that particular party about, you know, their stance on ageism, their stance on home and community care, support for people in the community. What is their platform? And it's based on those responses that they will either have my vote or won't have my vote. And it's interesting to see how many people actually don't know very much when they're running for an election about what a decent platform is around caring for older people in the country where they're trying to get elected. So use your vote is a great idea and everyone should be using it. Eileen, you made a comment that assets are taken into account in Ireland and individuals pay 80% of income based on the models of care. So it's probably similar to an Australian model to a degree in terms of accommodation bonds. But you mentioned accommodation bonds, Dan, and I know that for when accommodation bonds came into Australia, there was a huge uproar from families recognising that they may have to sell the family home to actually pay the cost of an accommodation bond or take out another mortgage to pay the cost of accommodation bond. But I think over a period of time, people have come to realise, well, the amount of retention that an organisation has from that accommodation bond, and if the bond was $500,000 and the person lived in that home for 5 years, we know that the family assets are going to probably get $400 of that $500,000 back as part of the estate. So the advantage, of course, it gives the operator the opportunity to have a significant cash injection to actually do the redevelopments and fund the services that they need. Because for every vacancy, there's another accommodation bond coming in before the old accommodation bond goes out. So accommodation bonds certainly, I think, would be a good thing everywhere. You've also, just going back to here, you've made some comment about how we at the Global Cafe participants can take action to bring about the changes that we all envision. So what are the things or actions that we can do to bring about the change that's needed?
It's a good question. I think the ongoing advocacy is really important about being a voice out there. For all of us to be talking to our local elected officials, to be writing if you're able to write or submit articles in the local newspapers, to be connecting with people, celebrating things, highlighting things, and really kind of keeping that message, that movement out there. That we got to change the culture in long-term care. We need to invest more to really show perhaps the perspective. And my lens always is the human rights of older people. When we hear stories about families being separated during COVID, when we know the challenge really of getting outside during the day. I think in Canada we have the right to complain about the weather, like in most countries, and it's not even easy for people to get outside and live in long-term care. And even the food that we serve in long-term care, you think hospital food is okay because you're only there for a few days, no matter what it tastes like. In a care home, the food certainly should be delicious all the time. And if you can't swallow, if you have dysphagia, you should be able to eat what your person next to you is eating, so that you have that dining experience. Kin Village, we're one of the first in Canada to reform food so that it looks like the food it is. So I think highlighting the innovation and pushing that forward. Greg, the example in Australia that you mentioned about the bond model. So because of that, I can think of 3 care homes that were completely renovated, rebuilt, and built kind of state of the art. Montefiore, for example, in Sydney, beautiful building, well invested, supports a range of incomes and etc. top end in terms of quality, but affordable. The Italian, I think it's called Scavallini, I think is the name of the care home. They built a beautiful building that feels like you're in Tuscany, and they really cater to the Italian market, and rightly so. And the way they're caring is amazing. And I mentioned there was a private care home I visited also there that was brand new, and it felt like a hotel. And they were able to even have rooms, believe it or not, in a long-term care home where couples could live together. I've never seen this for an actual bed that was hospital grade, and it was a couple's bed. So you think about if you can have that investment, it makes a big difference. So I just think continuing ourselves to be persistent and out there advocating and connecting, getting involved. If there's a local seniors organization, an advocacy group, if you can speak to those people. We did this a couple of days ago with Rotary. There's other service groups and clubs you can speak to, and I think just continue advocating. And I was looking at Greg and Jane and thinking, and Luana thinking of all the resources that IFA has advocating, because even when we advocate for issues that are not necessarily long-term care specific, but if we're advocating for vaccines, for example, or advocating for better hearing or eye care and solutions that way, we're advocating for long-term care, because those things seniors need as well. So I just keep on, that advocacy voice is so critical, and I think good things will translate from that.
Thank you, Dan, and certainly it's an advocacy voice from everyone that's sitting at the cafe today. I mean, we need to all be strong advocates to actually improve the systems and quality of care. I'm interested, Dan, because one of my bugbears here in Canada is, particularly in Ontario, is that the minimum standards for construction of long-term care, which I think are 30 years outdated, still specify that a home only has to have one washroom or one shower room per 25 residents. So most new facilities might have a shared washroom of a sink and a toilet, but people still have to be wheeled down corridors if they're going to have a shower or be in the bath. So in terms of your new redevelopment, are the minimum standards in BC different, or are you going beyond those minimum standards to ensure that every individual has their own ensuite?
Yeah, so it's an interesting thing to think about. So people who, from my perspective, the argument of people who say you don't need your own ensuite, you don't need your own shower or bath available, and why you need so few is because they'll say people who live in long-term care, their skin's different than ours. They don't need a bath every day. So in BC, the standard is one a week. And I don't know about any of you, but the temperature here in British Columbia, there's a heat wave going on right now. I might shower twice a day. And any person living in long-term care, it seems pretty simple, that they should have access to their own shower. So my belief, and I know the standards, depending on where you are, it is for a shower in that ensuite. Unfortunately, sometimes that is a shower that you might see in some small hotels, where you have, the bathroom, which is kind of a large, I think, outhouse feeling, right? It's that square shape.
Looks like Dan's been locked up for a minute. So while Dan's coming back on board, I will introduce you to next week's speaker, which is Dr. Noel McCaffrey. He's talking about transforming health with integrated care for older adults. So we will be certainly an interesting discussion. Great speaker. So please join us for next week's Global Cafe. I would also encourage you, I think we're down to nearly a five-week countdown to the global conference in Bangkok. Some of you on this call I know are registered. Catherine, I'm looking forward to seeing you in Bangkok, and others. So please do take the opportunity. You can still register. It's never too late. Dan, are you back with us now?
I'm back. Sorry about that.
Oh, that's all right. I mean, you were frozen. So, Dr. Smith, you have a question, which I would love to hear the response to.
Dan, first of all, thanks for all that you do, not only with IFA, but on the global community. I always appreciate hearing and reading your materials. My concern, and I've heard some people talk about the changing of the culture in long-term care, but I'm a firm believer that it really drills down to the staffing that you have. And some communities will have staffing ratios, which frankly, I don't support. I think that just having numbers is inappropriate. I think really creating the right caring community requires caring staff. And I think also in your situation, you're in a different demographic area where you will have difficulty getting staff. So how do you recruit and obtain staff? And then frankly, on a managerial level, how are we training leaders to be our successors as we move along in this field of long-term care?
Yeah, so a challenging question. And I think in a limited time, it's hard to do justice to that, because I think that's a complete policy movement, if you will, or a policy package that governments are and industries responsible for putting together. So I think we do need a very large, a comprehensive package that would encourage people to work in long-term care, encourage support leadership, and provide the kind of workers, if you will, and vision that we all would love to see. At Kin Village, we're blessed. I was blessed when I started a couple of years ago to inherit some phenomenal leaders, very competent, very kind of right-minded, very just culture that we have, supporting the team there. And that really is the bottom line, is kind of supporting the strengths of.
And so Dan, if you're probably going to come back in. So look, it's been a really interesting discussion today. Dan's a fabulous speaker, great person to listen to. I would certainly encourage you, if you've got questions of Dan, reach out to Dan at any time. He's very engaging. And the other thing that I will let people know is that it was 10 to 4 in the morning when he first got online with us here today. And I know for the IFA, we had a board meeting at 7 a.m. Toronto time, which again is 4 a.m. his time. And he'd only finished a board meeting with Common Age at 11:30 the night before. So Dan is certainly committed to the field of aging. He's a great contributor, contributes to all the organisations that he supports and is part of, and he's a great ambassador. Dan, I know you've just come back online. Your internet at home seems to be having a little bit of trouble. He was online. Yes, he's back online. So Dan, as we wrap up, I've got the question that I have for you is if you had a magic wand, really, what are the 3 wishes that you would want for in long-term care as we finish this global cafe?
So 3 things. My first would be that sustainable funding model, making sure that we have the kind of funds we need to do the work that we envision we should be doing. I think we got to make sure that it's stable funding, that we support it, so organizations, communities, municipalities can build the kind of long-term care systems that we need, and making sure that we have sustainable funding for that. That's not year to year, it's long-term. Second would be reshaping the long-term care system altogether. We have standards, national standards now in Canada, but seeing the whole continuum, and Greg, to your point earlier, making sure that we have home support and community-based services. So really making sure that we have that the next generation, if you will, of long-term care. And I think the other piece is focusing on different paradigms and different models, the dementia villages, the age-friendly communities, dementia-friendly communities, making sure that we have a different perspective and not being saddled, or if you will, by the heaviness of the past, by our origins from the almshouses, but thinking about a whole different way of older people being integrated into communities where they live.
Thank you, Dan. Look, I couldn't agree with you more. And all the work that all of us do really is about advocacy. And our advocacy really has got to focus on how do we actually get governments to change policy for the betterment of older people in the communities where we all live. And I think we all have a commitment and a role to play in shaping government policy to make and facilitate changes that are needed as we move forward. Dan, you always inspire me. You inspire me in the fact that you can get up at 4 o'clock in the morning after a board meeting at 11:30 the night before and deliver such an inspiring discussion today. So I thank you for that. Your leadership, your commitment to the IFA certainly doesn't go unnoticed by anyone. So I thank you for today, as I'm sure everyone else on this call does. So thank you. And I will say goodbye, farewell, good evening, good morning. And please join us next week for our Global Cafe next Friday, same time. So Dan, the final thoughts are yours.
But just thank you, IFA. Thanks, Greg and Jane and the team at IFA. Thanks for organizing this, Luana. And thanks all of you for being on the Global Cafes. I think this is a great dialogue, a great opportunity to have these important conversations we need to have. And the IFA, certainly these Global Cafes, I remember attending these a few years ago during the pandemic when we really were isolated. It was a great way of connecting with like-minded people who are concerned about the rights of older people. And I just commend all of you for all your work in this and your interest in it, and keep charging ahead, and appreciate it's a upward journey, but we should be trying to not accept anything but what we know is right for older people. So just commending all of you, and thank you, IFA, and hopefully we'll see many of you in Bangkok later next month.
Thank you very much, Dan. Thanks, Luana, and all of those who helped get today working. So thank you, and we will see you all next week.